Hello, everyone. Welcome to this very special edition of our Workplace EQ webinar series. We're very excited to have with us today Dr. Tasha Jackson, our clinical director at Tava Health, and also our very special panelists who will be joining us today for some discussion, Judy Lawton, who is an HR director at PackSize, and Becky Vea, who is the VP of Health People Operations at Health Catalyst. We're so excited to have them on the line to talk through some things. Today we'll be discussing mental health in the workplace and the opportunities that employers have to impact that. My name is Grant Keaton. I'm in marketing at Tava Health as well, and we'll be here just answering questions, manning the chat, and I will turn it over to Tasha to get things started.
Great, thanks, Grant. Thank you, Becky and Judy. Excited for this conversation this afternoon. I'm gonna go ahead and share my screen. Grant, thumbs up, we're good? We can see that?
Yep, we see that, and I'll just also add for anyone listening in, feel free to send us questions in the Q&A in the chat. Some of those we'll answer while we're going through the discussion, but we do have a Q&A section at the end of this dedicated to that. So any questions that don't get answered along the way, we'll be able to address at the end. So please send those in.
Great, thanks, Grant. So just to sort of lay out what to expect for our time together today, I'm going to spend just a few minutes sort of introing sort of the problem, right? What do we see going on as relates to mental health in the workplace? I'm going to share some statistics from a recent mental health in the workplace survey that's been done. And then really the heart of our discussion today will be with Judy and Becky talking about some specific opportunities and things that they've been able to see or implement, some guiding principles, et cetera, around mental health in the workplace. So a couple of goals, hopefully for our time together, we talk about the role of employers as it relates to employee mental health. I think currently, unlike perhaps maybe other times in history, employers are in a really unique role to be able to positively influence the mental health of their employees. And I think that we're seeing lots and lots of employers recognizing the opportunity that's there. As I mentioned, we'll spend a few minutes sort of talking about the scope of employee mental health challenges. And then more broadly, we'll talk about some strategies for creating a healthy and emotionally safe work culture. We'll identify some skills to help your team manage mental health challenges, and then identify some ways to manage mental health crises in the workplace. And so, again, just to sort of lay the foundation to talk through sort of the scope of the issue as it relates to employee mental health. So I think it's important to note that mental health challenges are near universal, right? Of this recent survey that was done, the state of mental health at work, 76% of people who responded to that survey reported experiencing at least one mental health condition in the past year. And then within that, 56% of folks reported experiencing burnout, 46% of folks reported experiencing depression, and about 40% of folks reported experiencing anxiety. So if we think about our workplaces, we can imagine that 3 out of 4 folks may have experienced some sort of mental health related condition in the past year. 84% of the folks that responded to the survey reported that at least one workplace factor negatively impacted their mental health. The factors that were most commonly sort of identified as negatively impacting employee mental health had to do with doing emotionally draining work, challenges with work-life balance. And I think if we think about what's been going on over the last couple of years, that makes sense, right? So many of us brought our work literally into our homes. And so I think having that balance and those boundaries and that separation became a lot more challenging. And folks also reported a lack of recognition as being a factor, a workplace-related factor that impacted their mental health. So we recognize that lots of folks are struggling. There's some work-related factors that are impacting that. But what's the impact of that? Like, why is this important? And so I think there's a couple of reasons. The first being that mental health reasons have been on the increase in terms of reasons that folks are leaving their work. So again, of the survey that we're talking through, about 50% of full-time US workers reported having left their work in the last year related to mental health reasons. It's pretty significant. If we look at some particular groups within that, we see that is much higher for our really young folks, our Gen Zers, at 81% of folks, and 68% of millennials. If we look within this 50%, 32% of them are voluntary departures. So that's folks voluntarily making the decision to separate from work related to their mental health challenges. We also see significant impacts as it relates to productivity. On average, folks are reporting working at about a 72% of their full capability. So the folks who are coming to work are not at their best. And then we're seeing that folks are also tending to miss an increase in the number of days missed from work to about 8 per year. So I think what this tells us, right, is that this is a pretty significant challenge. And I think that we can see that work is certainly overlapping with folks in their mental health and their everyday lives. And so I think, again, employers, workplaces have a significant opportunity to positively impact the mental health of their employees. And so I'm going to talk through just a couple opportunities, and then we're going to turn it over to our panel. So I found this statistic really fascinating, and this one has been on the increase in the last couple of years, but 65% of folks who responded to the survey reported that they've talked to someone at work about their mental health in the last year. And I think that that's fantastic, right? I think about what has to be happening in those workplaces and within those managers and within those teams to have created a space where someone, about 65% of folks, feel comfortable talking about their mental health challenges in the workplace. I can think about many places that I've worked where that hasn't been the case and people did not openly talk about their mental health. And so I think this is telling us that something is shifting in a really positive direction. We're seeing that companies are investing more into workplace mental health, right? We're seeing strategies such as increased paid time off. Mental health days are being allocated and used. People are doing mental health trainings, right? We have these sorts of conversations. People are regularly talking about mental health and say, what do we do? How do we access resources? What does mental health mean? How do I know if I'm struggling? These sorts of things. We're noticing that folks are taking extended or more frequent breaks, right? To give themselves the time and the space that they need to address their mental health and then to come back to their work at closer to 100%. And that we've noticed some adjustments to the way that folks communicate with each other, right? We know that so much of what we're doing is asynchronous. And so we've seen some changes with that are all positively impacting employee mental health. And so just to give you some numbers here, mental health resources offered by companies grew. PTO offerings went up by 55%. Mental health days increased by 41%. Trainings in the workplace in around mental health increased at 33%. So folks are recognizing what's happening and are making some adjustments. The last thing that I'll share is that we're seeing that creating cultures that support mental health, that those efforts are on the rise amongst employers. We've seen an increase of about 32% of employers identify mental health as an organizational priority. That 27% increase in leadership that are advocates for mental health, right? And so leaders who are actively talking about mental health in general, their own mental health perhaps, but are really advocating to make sure that their folks' mental health is a priority. And we're seeing an increase of about 21% or so of managers who are feeling equipped and able to support the mental health needs of their folks. And I think that speaks directly to the previous slide where we were seeing that increase in training around mental health. So at this time, we're going to transition just a little into our panelist discussion. I know Grant briefly introduced our panelists, but we've got Becky from Health Catalyst and Judy from Pack Size. What we're going to do is I'm going to go through several questions that we've prepared and give both Judy and Becky an opportunity to answer those. And then if I've got some follow-up questions to get a little bit additional clarity, I'll be glad to ask those as well. And then as Grant mentioned, we'd love to take some questions from the audience as well. And so, Grant, should I stop sharing?
Yeah, we can go ahead and shift to the gallery view.
Perfect. Great. All right. Let me get my questions pulled up. All right. So, Judy, since you're off mute, I'm going to go ahead and start with you.
Okay.
Can you talk with us a little bit about challenges that either companies in general or that you're noticing at Pack Size around mental health in the workplace?
Okay. So what came to mind when you first asked me that was the fact that most of us actually recognize that families are not as sheltered as they used to be from global conflicts, natural disasters, bad news. And so families are impacted by that. And of course, I think in years prior, it was just sort of an expectation that you come to work and you leave your private life at home. And that's just not the case. I mean, that's just not real. So when I come to work, global issues, family issues, my own family's wellness comes with me. And so my concerns come with me. So I think a challenge that we find is that I would say in years past, we haven't really acknowledged the struggle. And if you can't acknowledge that there's a struggle, then you might not come across very humane. And I have to admit, for us, it's like we want to see people as people. And if I've got struggles, you've got struggles. And why don't we make this a safe space to kind of talk about those? And guess what? We're also going to create resources that can help our families, I guess you could say. So when we talk about that, we've now moved to a hybrid workforce. We don't see each other as often. There's isolation, especially during COVID. People are feeling the heaviness of all the social issues and demonstrations and political disputes and what have you. So those are all challenges, and that's what you asked about. So
yeah. Great. And I love that you said we want to see people as people, and that I think that recognition around the stuff that happens outside of work, many of us bring that with us to work, whether directly or indirectly, right? But it's showing up for us. And I love that you guys are taking the approach to see people as people. I'd love to understand a little bit more about how you've been able to do that.
Is that a question you'd like me to address?
Yeah, absolutely.
We have something magical.
Share the magic.
Okay, so back in 2016 for Christmas, one of our co-founders read a book, Leadership and Self-Deception. It was written by so I'm touting a company right now, Arbinger Institute. And from that book, they created a course, and some of us went to that 2-day course. They offer it globally, but they happen to be headquartered in Utah. It was so meaningful to those of us that went that we got certified in order to deliver developing and implementing an outward mindset. And one of their lines, I have borrowed it, seeing people as people, recognizing the humanity in others, that you matter like I matter. And it's so foundational that it impacts our private life probably more so than our work life, but we bring it to our work situation. But the course is built to say, think of something that's you're struggling with in your personal life. Think of a relationship you're struggling with in your work life. And so you get to think of both, but employees are telling us it has a more profound effect in their private life, but it does impact how we work with one another. And it's like, We have a common language for certain things. So there's more, it touches everything. Health, how I feel about you, how I see you, that I recognize you and the humanity in you, your vulnerabilities. And I'm also saying, how does my work impact you? And how can I be more helpful? I'm not offering to do your work. I'm offering to do my work a little differently so it's more helpful to you. It has been, I use the word magical. We take it all around the globe. We make sure all new hires go through it in their first year. Our employees love it. And it has created such a community.
That is amazing. I think that really is magical. And as you were talking about sort of a common language and some traditions and stuff that you've built around it, I mean, I think that really speaks to the culture piece, right? Culture is having similar
High impact on culture.
Yep. That's amazing. Excellent. Becky, I'd love to hear from you. What are some of the challenges that you guys are facing around mental health in the workplace?
Yeah, a lot of what Judy shared, I think, resonates with probably everyone on this call, quite frankly. Being a tech company and, post-COVID, we are nearly fully remote. And so one area our team members have expressed they've struggled with a little bit is that human connection. And, you can only establish so much on a Zoom call. And there are some people who've never met people on their team in person because when they were hired, it was during COVID and we were all remote. And so there's just something different about sitting in a room with someone and that feeling and that emotional connection you can make that is lacking, unfortunately, in our remote environment. And I think we're all, as companies, trying to do as much as we can to ensure that connection is maintained. But I do think that has an impact on mental health and, connecting with others. And as Judy mentioned, lots of times, there's a spike in COVID and people are on quarantine or you're only with your immediate friends and family and, travel restrictions, those types of things. And although it's getting better, human connection, I think, is inherent to the happiness of human beings and people. So missing that, which you often get at work, can sometimes be difficult. The other challenge I would say that is probably not unique to us is, it's unfortunate, but we don't have a lot of resources, as many resources as we need in this space in the US. Medical plans are often lacking in the coverage and time it takes to get approvals and those types of things and seeking care. You may have to wait months to get into a provider, if you want to see someone in person. And that is where we struggled, is just continuing to have people say, yeah, I found somebody, but they can't see me for 6 months. I have a kid who is in crisis and I don't know what to do because somebody can't get me in for another 3 weeks. And, I realize this isn't a Tava sales call, but that is why we started looking for something to supplement our plan, is because we needed team members to be able to get access to care in a way that was easy and more immediate than, weeks or months out. But I still think that's a challenge where we'll continue to face just the availability of people and professionals in this field who can offer help to those who need it.
For sure. Yeah, I think there definitely are some challenges within the system, right? As a clinician and working alongside clinicians, I know how very busy so many of them are and wanting to take on more to support folks. But I'd love to go back for just a second, Becky. I've had the opportunity to talk with some of the Health Catalyst folks a couple of times over the last year or so. And I know that you mentioned the working to maintain some of that human connection, and the limited interactions I've had with you all, it is a deeply connected, caring group of folks there at Health Catalyst. And I'm wondering if you could talk a little bit about what are some of the things that you all have done in a remote or hybrid world to maintain that connection, because again, it was pretty evident to me in the few times I've been able to be around your folks.
Yeah, I have to say, I think some of that magic Judy's talking about is inherent in the work that we do. We have a great mission. And so people who want to make a difference and improve the healthcare in this, in this country, come and work for Health Catalyst, because that is the type of work that we do. So we have a very, very engaged population, one. And I think that helps, because when we share messages like, hey, your mental health and well-being is important to us, people really listen and respond to that. And so I think we just have really great people that work for us. And so I don't know that there's a magic formula to finding those right people, but we've been really good at aligning the right people with the culture we're trying to promote. But moreover, it's like Judy shared, we do look at people as human beings, not as resources, not as commodities to be shifted and put where we want them to be. And that has to come from top down. You know, HR, people ops, managers can only do so much. But if you have leaders at the top of the organization who see people as resources, that mentality is going to trickle down. And so we've been fortunate to have really great leadership in our company that every single time we start an all team member meeting, our CEO says, we've got a chart that says, you know, there's a circle and this is someone's life. And then there's a teeny little circle within the circle that says, this is what you know about someone's life. And what you see at work and your limited interaction with them is pales in comparison to the life that they may be leading and dealing with. And what I have found with people who have been, you know, trusted me enough to open up is there are so many people that are struggling with a lot of things with family members for themselves. Those you would never see at work. And so just reiterating that time and time again, that let's not pass judgment when someone may react poorly one day. Someone acts out of character. Let's not immediately, you know, forevermore make them think that they can't come back from these things because it could just be circumstantial. And let's be forgiving. Let's ask for clarity when people are being offensive, and let's assume that they're not intending to be offensive. But you know, that doesn't mean they can be. It doesn't mean we let them get away with it. But when we talk to them about it, we're assuming their intentions were not malicious. And when you start to take on that aspect of these are human beings, and that is a top-down approach, then you can't not even get on a Zoom call and see someone and not feel like there's another person who's struggling with something I may not be aware of, and just always keeping that top of mind. The other thing is, you know, we, especially since partnering with Tava, have just really been very vocal about mental health and well-being and the importance of it. You know, Tava is great about sending us resources like, hey, here's a great article, or mental health awareness or suicide awareness. And we send those out all of the time. We're communicating it all of the time. So we're just inundating people with this education, letting them know there's help, there's things that you may be dealing with. Here's some warning signs in case you're not sure. And just really trying to do a lot of education around mental health and well-being. And I think people are responding to that in a very positive way.
I love that. Thank you. You both talked to seeing people as people. Becky, you added on some additional things like not passing judgment, but sort of within that, right? Offering forgiveness, asking for clarity, assuming goodwill and intentions. Those to me really sound like guiding principles, right? About how we approach people and our interactions with them. And I'm wondering if you would categorize it that way. And then if there are other guiding principles that you think of as it relates to mental health in the workplace, or how you approach mental health, or how you think about it.
Yeah, I think those are great guiding principles. I think another one I would share is, you know, working in HR or people operations role for like 20 years, this has been a conversation we try and shy away from, right? If I know you've got something going on now as a company, we're at risk, right? How do we help you with that? And so that's been just even personally a mentality shift of, yeah, we do want to help you, and we'll help you within reason. And we want to work together to find the solution. And what I found is when people come forward and need help, you know, rarely can we not find what is an amicable solution to help make sure work is getting done, but also supporting them with what they need. And so just not being afraid to engage in those conversations and ask questions and really find out what people need support. And also know that if you can't offer the level of support that you're willing to, like, there's options there as well. And so I think that is good guiding principle is just don't be afraid to engage. That doesn't mean you have to say, hey, tell me what's wrong with you. Tell me what your diagnosis is. But you can ask, like, how can we help you? What does that mean? What can we do to better support you? And you can do that without knowing what the diagnosis is. And they may tell you, I just need a couple of days off. I need to take a personal leave of absence. I just need a mental health day. Can I just take today off because I woke up and was really having a bad day? I don't need to know what was going on. I just need to know that that's something that I can do to support you.
And just to tack on to something that Becky was just saying is that sometimes, well, no, I think we're both saying we need to make it comfortable to ask, so that's number one. But when we are observing, if I'm a leader and I have a team member that I'm observing something that's out of sorts, like their performance is deteriorating, their absenteeism is high, their interactions aren't as collaborative as in the past, I can always sit down and say, I'm concerned. I'm genuinely concerned. Again, I see people as people. You matter like I matter. Your success matters to me. These are some things I'm observing. Is there anything that's going on that we as your employer can be more helpful to you? I haven't asked for a diagnosis and I haven't asked for, now they might tell me, they might feel so safe that they could say, I have taken my teenage son to emergency rooms twice because there's been 2 suicide attempts. They might tell me, but they don't have to. Just like Becky said, us asking, is there something we can be doing? And yeah, she might say, I need to access some leave. Oh, okay, well, let's talk about that.
I love that, Judy, just focusing on the behavior, not on the diagnosis, not on the person. And I think that's the other thing, separating any mental health challenges from the person, doesn't make them a bad person. It doesn't make them a low performer. It doesn't mean that they have issues, and so you've got to separate that. I think the mental health challenges they have with the person that they are. And, I saw on the chat, this is such a gray area too for managers, because one word of caution I would say is you're not trained to be a counselor or a therapist or a psychiatrist. And so as people are sharing with you their concerns or the problems or the issues they're having, it's not your job to solve the problem. It's not your job to give them advice on how to make it better, on what the right choice in life may be. It is your job to ask how you can support them. Yeah, tell them about all these great resources you offer. Yeah, and encourage them to take advantage of them. Give them time off if they need to go to appointments. But you don't want to get into the realm of where your one-on-ones or your coaching sessions become a counseling session, because you may not be giving them the right guidance. Managers aren't trained as clinical psychiatrists or social workers generally, but there are people out there who are. So just balancing the support and connection, as Judy shared, with the need to make sure they get the right help.
Yeah, I love that. I would add to that, I think recognizing our own limitations in that manager, that leader role, or that colleague role, to be like, I want to listen and support, and I'm not a therapist. I don't have the answers, but I can be that listening ear. I can point you in the right direction, but sort of recognizing like where our own limitations are, right? I think is really important in that. I want to go back to something, Judy, that you said, and I think you said that both you and Becky are saying this, and I think that is the case, but you said, we make it comfortable to ask. And in my mind, I'm like, oh yeah, of course.
How do you do that?
You knew exactly where I was going, because I think when we say things like that, it sounds so easy. And I know there's folks on the call that are like, yeah, absolutely. And then they're like, what do I even do? So I'd love to hear from Judy and Becky, like, what are some of the things that you all are doing, or people within your companies are doing to make it comfortable to ask?
There's nothing like a global pandemic to upset the apple cart. And yes, COVID caused us to approach a lot of things differently. We are so lucky at pack size that we can look back and say, we weren't intending on doing that or applying that approach, but thank goodness we did, because all these positive things have happened organically. But I will tell you that when COVID, we were just a few months into it, we were expecting a serious decrease in revenue. What are we going to do to sell our way out of it? Blah, 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 blah. Our global leadership team, they made a commitment to us. We have Slack. Every morning, they recorded a 5 to 7 minute video that talked a minute about business, a minute about what's going on. How is pack size handling this in the other countries that we're in? What do we know about the science? We were very big on promoting science does this. We're going to follow the science. But when those global leaders say, we're going to talk about mental health, no matter how uncomfortable it is, because quite frankly, they knew that that would be really uncomfortable in Europe and Sweden. You just don't do that there. But we're going to talk about it. And that's what we're going to spend the next 7 minutes talking about. And our CEO ended up sharing that very close friends of ours have lost a son. Nobody saw it coming and what have you. And I mean, he's visibly upset. And in the next several days, we hear from every single one of those leaders about a challenge they're facing. My teenage kids are at home. They're trapped with me. They can't go out with their friends and it's becoming difficult. Somebody else is admitting that their child is struggling in some way, or so they all had a challenge that they shared. And so we made it more comfortable. And can I tell you, something magic happened the day our CEO looked at the camera and said, when you're on a call with your team, encourage everyone to have their camera on. You don't care about bad hair days, but you do care about them. You want to see, how are they looking? You want to be able to say, Tasha, how are you? And then he said, I want you to turn around and say, no, really, how are you? Can I tell you, people were doing that left and right. When people started doing it to me, it just moves you and say, well, to tell you the truth, that seclusion at home, I live alone. I'm really lonely. And you start talking about that. And it just creates a little more, I don't know, softness and all those things that we talked about, being connected and kind of understanding the struggle. So I really acknowledging the struggle was a big thing.
I love that. Becky, what would you add?
Yeah, I love the idea of leaders going first. There are some old school mentalities that COVID forced us to examine. The more hours you put in, the better worker you are. The fact that you are a single mom with 4 kids and your kids are never in the background on a Zoom call makes you a better worker. None of those are true, and I think to Judy's point, COVID really shone a light on some of those biases that corporate America has had for decades.
Again, the humanity.
Yeah, exactly. And vulnerability, or not being a vulnerable leader, is another, what I think, old school mentality that has kind of been a hanger on with workplaces in America, that leaders have to be strong. You can't show any vulnerability. You can't show any quote unquote weakness. You can't show emotion. And that is just not true. And when managers are willing to be vulnerable and go first, and like Judy shared, someone says, hey, I'm struggling, people now have permission to go first and share that part of who they are with people they work with. And that humanizes them and the people that they're talking to. Brene Brown, I think, is an amazing writer as far as dealing with vulnerability and overcoming shame, which is so crippling. And so I would highly recommend any of her books if you want to become a vulnerable leader and doing it in the right way.
Dare to Lead is a fantastic book. We did it as a book club in HR and recruiting.
Yeah,
we read it together.
Yeah. But yeah, I think that's the key, is just going first.
If we do a little bit of lightness here, we were talking about remote and COVID and what it caused us to do differently. We started hearing teams say, yeah, some of the things we're doing is like a Zoom coffee break. The whole team gets online, it's 15 minutes, and they're chatting. It's not work, it's chat. Our accounting team had a a quiz. I think it was like Family Feud, and they were on a call once a day. It was almost like a stand-up meeting. I don't know what it was, 2:00 every day. And it was 15 minutes, and they would do this little game together. We had some sales teams that said, once a month we would meet the kids. Here's a kid that I'm trying to keep out of my Zoom, but let's put them on my lap. And they met each other's kids. And then they ask each other about their kids next time. Meet the pet, the pet that crawls up on here. So it became a lot more lighthearted and okay. And you didn't have to pretend you didn't have a family behind you.
Mm-hmm. I love that. And I think this is a really important point. Again, the idea, like, make it comfortable to ask, right? And we say this as, I think it's sort of second nature. It sounds like a lot for you, Judy and Becky. And so I think it's just worth pointing out some of the things that I heard you guys say for the folks who are listening to, but leadership, being willing to talk about it, that leaders go first, right? I think in doing that, we're modeling what that looks like to own being human.
Tasha, we don't all work in an environment where the leaders go first. So we do what we can.
Absolutely.
It's like try to influence your champions, and you do what you can. We were lucky. We had a global leadership team that were willing to go first.
Yeah, I think that's such a great point, Judy. I know when we talk about leadership, I know we're talking about sort of like the CEO, the executive leadership, but I think that anyone can be a leader, right? I think there's lots of different ways to be a leader. And I think that's what you're talking about. It might not necessarily be the CEO but there might be someone, like you said, a champion within that team or that company that can be that leader.
Here's the way I like to say that. It's like, don't wait for your leader.
Yeah.
It's like, if you know this is the right thing to do, to be, I probably don't have to say anything more there. You don't have to wait for your leader to be kinder, gentler, forgiving, and effective.
Yep. I love that. Yeah, so I would say when we're in those organizations, right, leadership goes first. But I think your point, Judy, around don't wait for the leader, perhaps be that leader. We talked about modeling, that vulnerability and overcoming shame, right, Brene Brown. Making sure that message of I care about you as a person comes through, acknowledging those struggles. Becky, you talked about like identifying those unconscious biases that so many of us have and carry with us. And Judy, you talked about like making work fun, right? And not keeping everything that is not work separate from work. I want to be mindful of our time. I'm enjoying our conversation so much. But Judy, you told me a little bit last night about the project that you guys did.
Are you talking about us acknowledging National Mental Health Awareness Month?
Yes, exactly. Can you tell us about it? I think it was really fascinating what you guys did.
Let's give you credit. Our contact with Tava Health got a hold of us and said, hey, next month is this. I'd love to brainstorm with you what it is that you are doing to promote it. And if not, is there something we could help you with? Sure enough, we got on the phone. I think it was probably 2 or 3 people in HR with our Tava contact. And we just started chatting and brainstorming. And I said, what if we did a challenge? What if we challenged our whole US organization to make an appointment using Tava? So you're finding your therapist, and you keep at least 1 appointment before the end of the month. No crisis needed is what the tagline was no crisis needed, but we called it the proof of concept challenge because we have a lot of engineers and a lot of tech people on our payroll. So we promoted that. There was like a Slack message or an email every other day for a couple of weeks playing with that. Never asked for feedback. We never, but we got unsolicited feedback. Can I tell you 100% of the feedback came from men saying that was awesome. You challenged me and I'm not going to turn down a challenge. And I got online, I made my appointment. I talked to Tava person the very next day. That's what most of them said. And then some would say, I didn't have anything to talk about. I don't have a crisis going on, not a big challenge, but the therapist knew what to ask. And we just talked about, let's talk about some goals, what's going on in your life. Where are you stuck? Everybody is stuck at some point. And that's where their therapist took them. And a few dads kind of said, oh, because now I'm going to be more resourceful for my family. I've got a teenager who struggles with anxiety that I talk to my therapist about my role as a parent to help her get connected to resource, so it was magical. I use that word a lot, don't I? Magical.
There really is, I think we sort of joke that there is some magic to it, and also it's not magic, right? But it is magical to see it playing out. And I wanted to touch on one thing that you said, the no crisis needed. I think that speaks to, again, one of these beliefs or misperceptions around mental health, right? That something has to be wrong for me to need to talk to a therapist. And that's often not the case for lots of folks, right? I think to your point, Judy, like all of us are sometimes stuck somewhere, right? Or talking with an outside person can help us to gain a different perspective or access some resources that maybe we didn't realize that we needed access to.
I had my manager always refers to therapy as a massage for your soul.
Mm-hmm.
Nobody actually needs to go and get a massage, but don't we all love them? And so talking to someone is literally a massage for your soul, letting out all the knots and things that you may not even know exist till you start talking about it. And then next thing you know, wow, maybe there's stuff I'm dealing with.
I love that. You guys should trademark that, because that's really I may have to use that. I will give you credit, I promise. But yeah, I mean, massage for your soul, right? I think that's a great way to think about it, right? We may not think it's something that we necessarily need, but it's maybe a little painful along the way, but on the other side, we tend to feel pretty good. So I want to, we've been kind of high level, and I want to drill down just a little bit and make sure that we have some time for questions from the audience. But I'd love if you guys could both talk with me about, what do you do if one of your team members has a mental health challenge? Can you give us an example of something, obviously being mindful of confidentiality, et cetera, but how did you support that employee? What were some things that you did?
Becky, do you want to go first?
Sure. One thing I tried to do with my team is, one, just make sure they felt comfortable on how to handle this if it came across their desk, right? As people operations, I think we're sometimes the first stop, especially for managers or team members. We're kind of this unbiased third party. If I tell HR, my manager doesn't have to know, there may not be judgments passed, right? I think even personally, sometimes there's some stigmas associated with these mental health challenges. And so one, just again, making sure that those core rules are applied, right? You're not the one trying to solve the problem. We just need to figure out what support they need, was critical. And so what we would do, I think when this first started, a lot of managers would say, can you just talk to this person? HR, I think this is going on. Throughout the last few years, and I know we've got some of our managers on here, hopefully I'm not speaking out of turn, but now managers are starting to get more comfortable with this, and we've been able to partner with them to give them the tools to ask the right questions, to understand what they can do to support and get them out of the mindset of the problem solving, but rather be a support structure. Mm-hmm. And they are able to have these. And so now we're asking questions like, here's my suggestion for having the conversation. Do you want us there for support? Are you comfortable having the conversation? And then if something comes up like an ADA accommodation or FMLA, again, you don't have to have the answer. Great question. Let me connect you with Becky. She can give you details on that. Mm-hmm. But you just being there to offer support for the team member is probably the most important thing that you can do. So when we have team members who come to us, that is really the first question we ask. How can we support you? What can we do? Not tell me more about what happened or how are you feeling about it? But gosh, that has got to be so difficult. What can we do? And if they don't know, we just offer the resources we have and then really encourage them. And then following up, hey, Tasha, you and I touched base a couple of weeks ago. Wanted to check in on you. How are you doing? How are you really doing? To Judy's point.
How are you really doing?
Yeah, exactly. Were you able to get in touch with the resources I gave you? Have you been able to utilize them? Were they helpful? If not, what else? Let's explore other options. So in general terms, those are things we try and do when something comes across our table.
There's probably nothing I can really add to what Becky said, except can I just acknowledge that there is a continuum. there can be this, for a lack of a better word, I'm going to call it severity. There can be a continuum. And once in a blue moon, HR might get approached because there's danger involved. Someone might be a threat to themselves or others. So we just want to acknowledge that it's not always simple. Sometimes it's difficult. You know, what maybe a company needs to decide that we're going to get you in touch with some, maybe the employee doesn't want help. You know, maybe they're saying, no, everything's fine. And it's like, no, we know that it's not fine, or we see and we recognize that it's not fine. And it might be that we're doing something very tailored and unusual. In that case, it might be that we would like you to see, you know, a care provider, and we'd like to know that you're really okay to return to work. You know, so I just want to acknowledge that there can be different levels of severity.
Yeah, I think that's a great call out, and that those situations, those crisis situations may require a different approach than Becky's, which I think is a great one around like, how can I support you, where you might have to be in a crisis or maybe a bit more directive or prescriptive about what do we need to make sure that you're safe. So I appreciate you calling that out, Judy. I have a question from the audience. I think it's a great one. Excuse me. I experienced a negative conversation with a manager where they expressed criticism rather than concern over my well-being. What kind of advice do you give to folks who don't feel like they're in that safe space to be vulnerable and honest to their managers, particularly about our mental, physical well-being after receiving some criticism? So what might you say to someone who's either had a bad experience or doesn't feel that they're in that safe space that we've talked about?
So at a very high level, you remember how I was talking about how our global leadership team was communicating via video every single day. And then after, you know, a year and a half, that became 3 times a week. And then it became 1 time a week. One of the things they were always saying, if you ask for help, if you feel like you can't go to your leader, go to your leader's leader or HR. So they're always showing there's other paths, and those paths are available. If someone has experienced this really negative experience, they know that they can approach their leader's leader or their HR community.
I love that. Becky, anything that you would add to that?
No, I would have said the exact same thing. Yeah, there's always other resources. And I hope you have an HR team that can be that third party to help navigate that relationship with the manager, and get to a place where you can start to have this discussion with your manager. But just, you know, give some grace. This is new, this is hard. And there are some people that are farther along on the education spectrum than others and understanding this. And so, you know, in a perfect world, we'd all be on, you know, the Tasha spectrum, and we're fully embracing this, but there are some that for one reason or another, there is still some stigma associated with it. And so it's not a reflection of you or necessarily that person, but maybe there's just more education needed. Hopefully someone in HR can help bridge that gap.
There's a part B to that. And that is, if it happened in my sphere, I might say, part B is I'm going to approach that leader, and it's not going to sound like criticism. It's going to sound, I want to be more helpful. How did that situation go over? If you could do it again, what would you do differently? So I'm showing curiosity, listening and learning, and then you teach.
You're talking about to the manager specifically.
To the manager. It's like, let's influence that leader. And sometimes if you just ask a series of questions, they get there on their own. Like, oh my gosh, I just bumbled, you know, I didn't know what to do and what have you, or what, you know, but you do need to come back and coach the leader.
Absolutely.
And I see, just a follow-up to that, Tasha, on here, maybe we can talk through that too. You know, what if HR or a leader's leader isn't that resource? That's a really unfortunate situation. I think there's a couple of options. One, it may be outside the company that you need to garner the support through someone like Tava, a mental health professional through your medical plan, who can maybe help give you some guidance on navigating that relationship. I also think maybe there's some difficult decisions you may have to make. You know, if that is the type of support you need as a team member, as an employee, and this company isn't aligning with some of those core values and needs that you have, it may be time to see what else is out there and we'll look for companies that align better with that. And I know that sounds harsh. I'm not encouraging anyone to just pack up and leave their job. But if you're giving feedback and saying, I'm not getting the support I'm needing, nobody's listening and no one is hearing, you know, there's also a point where you have to take care of you and put your own health and well-being first. And not every company can align perfectly with that. It's really sad if that's the situation, but it is an unfortunate reality.
Good
Yeah, and
point.
I think, Becky, that we saw that in some of the statistics I shared earlier, right? That in the last year, about 50% of folks left jobs because it was impacting their mental health in some way, right? Yeah. And so that's a very real reality for a lot of folks. So I appreciate you calling out those other options. I want to shift gears just a little bit. I think there's some great questions coming in. I want to make sure I have time to get to all of it. So I'm going to talk sort of about DE&I and how that impacts mental health in the workplace. So I've got two questions. I'll do one for Judy and then one for Becky. Judy, how do you help folks who feel like they can't be or bring their whole selves to work in our political environment? For example, if people have told you about perhaps being neurodivergent, disabled, LGBTQ, like what do you say to folks who feel like they can't be them whole selves or bring parts of their identity into the workplace?
Okay, I'm going to sound like I'm doing an ad again. I was just telling you about our relationship with the Arbinger Institute, okay? That they developed a training that we have taken around the globe. Okay, we were looking and looking and looking for something that would support our diversity and inclusion initiative. I bet we looked 3 years for something that might look like a workshop, but they all looked alike and they weren't really touching on the things that we wanted to touch about. And they were, not quite meeting a standard we were looking for. The Arbinger Institute announced in 2021, they have a new product. It's a half-day course for individual contributors. It's 2 half-day courses for leaders. It's called Outward Inclusion. Oh, so awesome. We are now certified to deliver that in-house, and we have employees from all over the US dialing in for this half-day session, and we've probably delivered it 20 times this year. And it is, it allows employees in there's lots of content, expert content. We're not the experts. We're just delivering the content that's already been created for us. And then lots of interaction, lots of breakout rooms, and people of all sorts are talking to each other. And in my breakout, we might have 10, 15 minutes to talk about a particular thing that they're just asking us to talk about. And I come out to you. Or I end up talking about my son is autistic, or someone says, hey, I'm wired differently. I'm neurodivergent. I've had a leader say that, in a group setting, which he never did before, so it's like all of a sudden we are influencing our culture that's in line with our diversity and inclusion, but it has all this other unintended wonderful consequences. What can I say? I think it does a fantastic job on addressing this whole concept of being well and your well-being, and you matter like I matter. Mm-hmm. They're using all the same concepts as what they used with the outward mindset, and that too. And they give leaders tools. Oh, you want me to examine my team? Who on my team would tell me if I asked? They feel the least belonging. Mm. And the tool will say, oh, I think it's Sam. Why? I have to think like, and what kind of relationship do I have with Sam? Does Sam feel like I care about him? So it has a leader examine themselves. So the tools are really very effective.
I love that. So it sounds like you guys are doing a bunch of training, making it again a regular part of the culture, some different tools and to supply to your managers to make sure that they excuse me.
And it's almost not, it's not like hitting them over the head about their unconscious bias. They don't even use that word, but it is like, what do you really know about your team? Who on your team is perhaps feeling the least included, or, it's the tools are really highly effective.
Oh, excuse me. I love that. All right, Becky, last question for you. Oh, excuse me. Just getting over something. Apparently it just caught up to me. How do DE&I initiatives or lack thereof affect overall mental health in the workplace?
I think that's a great question and really relates to the last question where someone put how do we help people who don't feel like they can bring their whole selves to work? Lack of DE&I initiatives, lack of understanding of that everyone is different does take its toll on mental health in the workplace, because if you feel like you can't be a mom, you can't be gay, you can't be, BIPOC, you can't be of a different ethnicity or race, you can't, you don't fit in from a gender perspective, you can't be your best self at work, and you don't feel welcome, you don't feel included. And inclusivity is so important, right? There's diversity, which is why it's DE&I. Diversity meaning different mindsets, different people, the way they look, the way they think, the way they act. Equity meaning is everybody being treated the same, but inclusion, I think, is one of the most difficult ones to conquer, because you can have the most diverse population in the world, but if people don't feel like they're part of it, it is going to take its toll on their mental health and well-being. And so I think it's important to recognize that this is complicated. There are so many factors that impact people's mental health and well-being, some that you don't even know because you've never experienced them yourself, and some that you can relate to. But it's just opening up those conversations and understanding that circle analogy that I mentioned. How do you expand that circle from that pinpoint of what you see people at work and really start to expand what that larger circle looks like about who they are in real life? I think starts the path of understanding. And we don't have to always agree and see eye to eye. I may not think like you think, but that doesn't mean I can't respect you as a human being. And that is the core of DE&I initiatives. And what I think we need to do to combat the impact that it has on mental health is just start to get comfortable with the differences and being okay with disagreement without me not liking you because we don't vote for the same person, because I don't agree with the same legislation you do. That doesn't make either one of us bad human beings.
I love that. And I think the visual, of the circle and like, what do I actually know about you? It's just this little pinpoint, right? And how do I expand that circle? I might never know everything within your circle, but I think, how do I make that small dot bigger? And then also the awareness that I will never know everything, right? What else is in that circle with you, I think is a really important piece of knowing as well. So I know that we are right at time. I am forever indebted to the two of you. This has been an amazing conversation. Judy, Becky, I can hang out with you for several more hours and pick your brains, but thank you. It's been quite an honor to spend some time with you this afternoon.
Thank you. And Judy, I've loved your experiences. You've helped me a lot. So I appreciate you sharing. I've learned a lot as well. So thanks for giving us the opportunity to share what's worked for us, Tasha. Hopefully everyone's found it useful.
See, Tasha, you're connecting people right here. Becky, let's talk.
Yeah, definitely. Let's stay connected.
Thank you, everyone, and thanks everyone, all the participants for joining and listening in. This webinar will be available as a video, and the deck that Tasha shared that will be available to all the registrants of the webinar as well. Thank you all again for joining, and we'll see you next time.
Thanks.
Thank
all.
you.
Bye.
Bye, everybody.